For people that are joining us back in the main room, I know we have some of us. There's a link in the chat to start to share kind of some of the take-home messages that you picked up from the session that you attended. I think most of the people that are back now are from the telehealth session. So I see one up as there's no such thing as a HIPAA compliant logo. Yes, that's a really important thing to know. And then someone else shared in chat that the HIPAA compliance forgiveness is ending over the summer. So again, that's something providers especially need to be really aware of, the rules kind of tightening up and what that means for us in terms of what we need to be doing. And someone says that telehealth resource centers exist, which is amazing. I'm happy that people are learning about the telehealth resource centers, just like people are learning about the regional genetics networks. We function in, have a lot of similarities in our federal funding and in the way we function across regions. So I'm really glad for people to get to know their telehealth resource center. And yes, bringing awareness to the fact that the end of the public health emergency impacts both HIPAA rules and compliance rules, and also what is eligible for reimbursement. Yes, and that vets use telehealth. Yes. Somebody also said that HIPAA compliance is harder and probably more complicated than they thought. The good news is that a lot of people that work in clinical settings, so if you're in an office, most hospital systems and healthcare systems have somebody in the healthcare system whose job it is to really be thinking about these issues. And that wasn't necessarily the case 5 years ago before COVID, that someone in the hospital system was really supposed to be thinking about these things. So if you are in a clinical system of some sort, find out who like, is there a telehealth office? Is there something you should be aware of that you can go to? And it looks like I'm seeing people coming back from the primary care session. So welcome if you're coming back from that session, and I'm seeing some of the comments come up from that session. There's a link in the chat if you're just entering to share something that you learned in your session that you think would be useful to other people to know.
So go for it. You know, genetics in primary care. We had a great discussion, and as you can see, went over time.
Oh, that's okay.
No, I'm looking at the 10:30 and whether we need to have a special group for the interface of this, because lots of great discussion, education, and talking about collaborative care offers of telegenetics as a solution to piece of this, but respectful of all the different state issues of specific mentioned by Bob around, you know, some places once you've established in an in-person visit can proceed with that, but obviously also issues of adequate, you know, numbers of providers, et cetera. So we had a really good, robust discussion.
Good. If telehealth was coming up over there as an important tool, then I encourage you to visit the conference website and grab the slides from the session that we just did on telehealth, and the recording will also be available, because we were talking about all the changes to anticipate as the public health emergency ends in May, and sort of the way that some of us have gotten used to using telehealth is about to change in some pretty important ways. So it's a big thing for providers and families to be aware that changes are coming. And I saw somebody just put in the chat that it's frustrating that we're heading back to some of the old rules, and that the way that families are used to being able to connect to and access their providers, especially in other states, is going to become more challenging.
I wondered if I might ask Elizabeth to comment on sort of the triage, you know, what actually, if somebody has, you know, from your state, a question about, let's start with pharmacogenetic testing, like, where would they look first? Would they look to your regional genetic network with a question? You know, how are you handling as your, you know, graphs and diagrams, and we know the questions are increasing, but different systems are handling in a different way. Can you tell us what has worked in Colorado for triage?
That's a great question, Joanne. You can hear me?
Yes, yeah. Thank you.
You know, it unfortunately, probably similar to many other parts of the country, depends on the healthcare system. And so in the University of Colorado and Children's Hospital Colorado systems, If patients have those questions, we do have, particularly for pharmacogenomics, we have pharmacists that can then triage those questions. Often it's a clinician reaching out to the pharmacist, and then there may be a patient visit connected to that in the future. There's not a lot of pharmacists who are trained in this area, so it's kind of just a very small number that triage these questions. Outside of our large university system, Kaiser, which Kaiser Colorado and Kaiser Washington just recently merged, and so they have the kind of their own precision medicine network that they're building. And then we have a lot of other private hospitals. So, and we don't have good connections between those. And so if a patient has a question related to pharmacogenomics, it often, in my experience, goes to either their primary care provider or another relevant provider. Let's say they have an oncologic or a cancer condition, and so they take that question to that patient or to that provider, and that provider may or may not be aware of the resources available to them. And that's one of our big, I think that's a challenge everywhere.
Yeah, I'd agree with that. As we're having these important conversations, I want people to be aware that on the conference website, you can see the slides that Dr. Kudron just presented about her topic in primary care and genetics. So if you didn't attend, I see someone put in our poll up here that there were some really great resources for precision medicine and for physicians related to precision medicine. So go grab those slides if you weren't there, so that you can get all those resources, and the recordings will be available in the next few weeks as well. Anything else people have last minute questions about? We have 1 more minute. If you have one more burning question for either Dr. Kudron or for the speakers in the telehealth session.
I guess I would offer up, we might want to have, when we have, open rooms or something, add a sort of pharmacogenetics, and Dr. Kudron, I know you may not be able to be there, but that would, I think there are enough, we cut ourselves off,
I can stay. I can stay.
Oh, great.
Yeah.
Okay.
Thank you.
All right. Okay, guys. Well, it is 10:30, and I'm gonna respect your break time. So you can go grab a cup of coffee, go to the bathroom, do what you need to do. We have a 10-minute break. So we'll come back together at 10:40 to kick off 2 more sessions. So our big thanks to Dr. Kudron and to our telehealth resource centers and Lynn Perry. And we will see you back in 10 minutes.